I'm Dr. Miner, and welcome back to our next segment where we're talking about the difference between a specialist and an expert tooth saver. And to give a little background, a patient came to us that a specialist told her these teeth need to be extracted, can't be saved. And so we're going over how we're going to save these teeth. So the patient brought us the notes from the specialist, which are right here. And we're going to go over those. We went over some of them on the last video. We're going to do the rest on this video and explain what these mean and how we can help. So these are the topics we're going to discuss in this video. We're going to talk about what do they mean by periapical findings, missed canals, perforation, what that means, and if there is an instrument fragment. So first we're going to talk about missed canals. And when we look at canals, ideally we want to be able to get into them and see them. So like on this tooth, we can barely even see. There's a little dark line here. That's the canal. When we look on this tooth, this tooth has a root here and a root here, and there's one in the middle, which got in the one in the middle. But you can't even see the canal on this. And that's what we call sclerosed, which the canal has just gotten so constricted, which happens with time, that we just can't get our instruments in there. So when we look at a 3D image, we can get an idea how many canals there are. So like on this tooth back here, these are the three roots on the tooth. And a lot of times on this root, there's two canals. And that little dot is a canal. But just because you see it here, doesn't mean you're going to be able to get an instrument in it. Or you could even locate it. Because sometimes, again, they're just so choked off, you can't even get into it, right? But you can see it on here. But if you can get into one, then not the other, we call it a missed canal. So here is an example. This patient saw an expert. I think they came from Utah. But again, you can see there's no filling material in here, but there is here, right? So they couldn't get into this canal, but they did the surgery from the side where you plug off the end. You cut off the end of the root because that's where the problem is going to be. And that's the solution when there's a missed canal. And here's a case we worked on these two teeth. You can kind of see where we tried to go in and find the canal. We're getting kind of deep, and we don't want to get too far in with burrs or whatever, drilling it out. And so we go in from the side, remove the end of the root on these, and put some filling material there and save the tooth. Now this is an example of where I showed you that 3D image, and there's the two canals and one root. So just because you get both canals doesn't mean it's going to heal. And so here's an example of that. So here is the one root. You can see the two filling materials. They got in both roots. But if we look closely up here, we can see this is still infected. Right? So this is where the root canal did not work. And again, the solution is go in from the side, remove the end of the root where the infection is, put our filling material in there, and save the tooth. In those notes that we saw in the beginning, right, the specialist makes this comment that there's periapical, furcation, and lateral findings. That really doesn't tell us anything, right? It tells us a location, right, which the furcation is kind of between the roots, and periapical is at the end of the roots, but it doesn't say what's there. So that's kind of like saying, I saw a car, right? Well, it's like, well, was the car going? Was it parked? What color was it? What kind of car was it? Was it a truck? Was somebody in it or not? So that kind of thing doesn't tell us anything. So we're going to talk about perforations. And a perforation is when you're trying to go in here and find a canal, but you might come outside of the tooth. And so that'd be like, so there's a canal here, but it's not treated. And this was done years and years ago because this filling material is probably older than me. But if we go with perforation, it's when you come in, make a hole, right? So now there's a communication from the outside, and using the laser to address that, there's a way to address that, is way more predictable with laser, right? Because we can go in, clean that out, put some patch material in there, and a lot of times it'll heal. So this shows a broken instrument. And what we're looking at is right here. So there's a little piece of instrument that broke off in the tooth. So that's on the inside. And this may prevent the tooth from healing, or the body from healing this area. And again, this is not the end of the world for the tooth, right? Because this happens more times than we like to think. But the solution is, again, we go in from the side, we just remove the end of the root, put our filling material in there, and save the tooth. Here's another example. This is a piece of the instrument down in here. And so, again, if it doesn't heal from doing the root canal, we can go in from the side, we'll remove this section of the root and fill it in. So that's the difference between a specialist and an expert. A specialist may look down in here or see this and go, that's too far, we can't get that. Because they're going to try to come in from the top to pull this out, which isn't going to happen. Or at least it'd be very lucky to have that happen. Where an expert knows, right, you can go in from the side and fix this. So let's say on that last tooth that we just saw, there was a broken instrument in here. Right, so this is what it would look like. Right, remove the end of the root, put some filling material in there, and save the tooth. So with the notes that patient brought us from the specialist, the specialist couldn't save those teeth. But as an expert, all of those things can be addressed and we can save the teeth.